I got it open.
You don't have enough followers to go live. You need 1,000.
Really?
Yeah.
Hmm. I thought I would have had it. I got 700. All right. Hello, everybody. I'm sorry I'm late. I had some technical difficulties. You can see I'm kind of moving kind of laggy, and I'm not really feeling well. So I canceled the study group for this evening, and we're gonna do it every day this week anyway. So, and since today we're doing our mentoring minute, it was gonna run into that as well. But we will continue the study group tomorrow, and I'm gonna introduce myself. Hi, everybody. My name is Ruby Simmons, and I'm your medical billing mentor, and I'm the owner of Blossom Revenue Cycle Solutions LLC. And today, in our mentoring minute, we are going to talk about the different types of medical billing and some of the different types of experience that you may need to do this type of medical billing. And I decided to talk about this today because I had several conversations over the course of my vacation with people who was who were saying that they were kind of confused about the types of billing and how billing worked, and they didn't understand why they needed to know certain things in the CPB exam and other things, just different questions like that. I had some people who I spoke to that were saying that they was working some temp work in a billing office, and the way that that provider was doing their billing and their follow up or their scheduling was really off to them, and they really didn't like the process. So I wanted to kind of come on and explain that, especially to a lot of the students that we have here, and even some of the medical billing agency owners that we have, because billing is not the same everywhere, and it is not the same for every organization or facility or private practice that you will probably get a job in or do the billing for. You have to understand that when it comes to billing, especially with a private practice, each private practice runs their billing differently. And that means that if they're running their billing differently, then that means that if you leave that particular provider, you're going to have to learn something new at the new spot that you go to. And a lot of people kind of get confused with that, especially when they're doing temp work. They're doing temp work, and they're really just getting into medical billing. So it's different for every office. It's also different for every specialty that you work in, because not all specialties register their patients the same way. Because depending on the specialty, if it's a private practice, they may need certain types of information that you wouldn't ask normally in just a general medicine office. And don't depending on the specialty, the patient may have to go through different steps before being registered or before being seen by the specialty doctor. And you, as the front desk person, have to make sure that you inform the patient of these additional steps and give them any documentation they need. And you may also be responsible for calling and linking the patient up or scheduling the patient for a visit with a different facility or clinical area for that patient to be seen so that they can get services in your office. So those are different things that you'll find in medical billing. I'll tell you a bit of story about me when was when I was doing medical billing. I had just left as a medical billing supervisor, and on the physician side, and I went over to the hospital side as a supervisor, coordinator type person. I had four coordinators under me that I managed. And in this position, it was the first time I had ever really done hospital billing hands on. You know, I worked a lot with the hospital as a professional biller in this particular organization because I liked to not just help the provider get paid, I wanted the facility to get paid as well. And a lot of times I ended up working large dollar projects for really sick patients to make sure that their services got paid for both the hospital side and the physician side. It was something that the hospital had about really merging the hospital and physician billing. I have no idea why, because it really works out better for both the hospital and the physician when the billing offices are together than it does when they're apart. I noticed that when they're apart, there's a lot of missing information and communication. But what happened is when I went over to do the billing on the hospital side, I found myself having issues when I was following up on claims and talking to representatives because they kept asking me for procedure codes, and I would give them the CPT code, but they would ask for additional procedure codes, and I didn't know what they were talking about. And it turned out that because the hospital uses revenue codes as well as CPT codes, um, they were referencing the rev codes as the procedure code, and I didn't understand that, and I didn't it was something new that I learned. And in that position, I basically learned that, you know, hospitals used revenue codes and they also use DRGs, and that the way that they set up their charge master and things like that was just a little different than how the provider did it. So it caused a little confusion for me. And then I took on doing billing for a specialty hospital, which focused on treating patients with severe brain injuries. And I also took on a nursing home. And sometimes in nursing homes, they're paid differently because most nursing homes run on a lot of Medicare billing. And sometimes, you know, we would have issues where if the patient, where was the patient at the time that they were getting taken care of? So let's say the patient got sick in the nursing home and was transported to the hospital, and Medicare didn't know, it would cause issues with the billing as to who had assignment and who Medicare should be paying. And sometimes we ran into issues where the nursing home had to pay us for certain services rendered to the patient because of just how the whole process was set up. So when you get into medical billing, you need to get used to learning. You need to get used to doing things different at each organization that you go to. Medical billing isn't just the same everywhere you go. And it's because you have so many different types of medical billing. It's because you have so many specialties that can be billed for. And it's just so when you learn in the CPB kind of gives you a well-rounded knowledge of medical billing. It's giving you hospital billing, and it's giving you physician billing, and it's giving you some nursing home billing and things like that, and lab billing. But depending on where you land, you have to learn that type of billing. So don't be surprised if you accept a position working for an outpatient clinic or urgent care, and you just left billing for a general medicine doctor. You've been there 15 years, he finally retired, and now you're going off to a new position. So don't be surprised that things are done differently. You have to go with the flow, learn the processes, learn the procedures, and be open to not getting things right or doing things wrong. Be open to asking questions and communicating because of how open, how diverse medical billing can be in each organization. So, with all of that said, I want to just give a couple types of different medical billing um, areas that you could be in during your career as a medical biller. So you have the hospital billing, you have clinical billing, you have ambulatory surgery center billings, excuse me. You have nursing homes and urgent care and rehab centers. You also have some mental health centers. Like recently, earlier this year, I worked for a one of the oldest mental health facilities. I was working on projects, so I didn't really work there, but it was a mental health facility in New York, and it's one of the oldest ones. And the way that they did their billing was so different. And they were just learning how to work on an EHR. So the learning curve and the teaching curve was a lot different because a lot of these employees had been used to working with paper. They had been used to working with file cabinets and pull out drawers, you know, and just old CRT based systems. And here they were taking on a new EHR system, and they had to be trained. So those are the kind of things that you run into as a medical biller. You can accept a job as a medical biller at a facility and don't realize what level they're at in their billing. They may not be up to standard due to the complexity of their billing, and you can run into things like that. So to get back to some more of the list, I want to go through all 10 of these. I already mentioned the nursing home, but you also have, the skilled nursing facility. I'm sorry, not just the nursing home. You have the urgent care centers and the rehabilitation centers, kind of like the one I was. It was a specialty rehab center because the patients had severe brain injuries. Some of them never left the facility. And you also have the imaging center billing. Um, Billing, and you have radiology and CTs and MRIs and things like that they do. And then you also have dialysis. And dialysis is different. The billing for dialysis is different. I used to do dialysis billing, and I had to learn how to do it correctly because dialysis billing I had learned for physician and hospital billing that You bill as soon as possible. As soon as you can get those charges in, you bill. But dialysis was different because we had to bill a month behind. Because with dialysis, they wanted a whole month of billing of the patient receiving their dialysis before they would pay. So it was a little different. And the same thing with hospital billing. Sometimes when a patient is admitted long term in a hospital, they don't always bill the entire visit once the patient is discharged. They bill sections. Like they'll bill the first part would be the interim billing, and then you'll have the end billing, and I forget what they call it, but they bill it in sections, like maybe the first couple weeks that the patient is in, and there's codes that help them to identify, which bill it is. Is it the discharge? Is it in the in between, or is it the beginning of the patient's stay? Excuse me, my mouth got a little dry there. So, and a lot of that is mostly facility billing, excuse me, or different types of facility billing. For excuse me, for providers, you have things like billing for nurse practitioners, and that works differently depending on if the nurse practitioner is working outside for themselves and they're an entrepreneur, or if they're working in a hospital and they are seeing patients in place instead under a physician, excuse me, under a physician, and that's called they also have a billing that's called incident to billing, and you have to understand that type of billing when you start to deal with billing for physicians and a nurse practitioner. And then you have physician assistants who bill as well. They can be in hospitals, but they can also, depending on states, like nurse practitioners, depending on the state that they're in or the type of business that they have, it depends on how you would do their billing. And sometimes in certain states, they're allowed to bill pharmaceuticals. So that means that you may be able to bill pharmacy services depending on how their business is set up and the type of um, medication that they're using. Is it a medication that's in-house that they purchased, or is it emergency? Is it a medication that's a specialty pharmacy? So you learn and do so many different things in this field, and you can never get bored in medical billing. Some people say, "Oh, I get bored. I don't like doing this and I don't like doing that," and whatever is bored. It's not to me, because there's so many different things that you can do in medical billing, and you can hop around and learn how to do this billing, then hop around and learn how to do that billing. And if you land in a hospital or a large physician organization or the physician side of a hospital, you could do multi-specialty billing. So not only are you learning general billing, general medicine billing, you're learning radiology, you're learning OBGYN, you're learning nephrology, you're learning rheumatology, you're learning trauma, you're learning ED, and you're learning pediatrics. And for all of those different specialties, there's something different that you have to do for the billing, or there's something different about the processes and the processes and the way that the insurance works for all of those. So that's a lot to know, and that's a lot to learn. And that's one of the reasons why I always say take notes, keep a journal, type it up, do something, because medical billing is vast. It is very vast. And so, as a physician, in the physician billing, to continue, you have physical therapy billing that you're going to be able to do, speech therapy. You have chiropractic too. You also have dental billing. and you have optometry as well. So those are different billings that you'll do, and some of these services, they never bill within a facility. They may own their own building, their own clinic, and it's just them there, and you're just doing global billing, professional billing. And what I mean by global billing is the provider gets paid, the facility gets paid for facility services and professional services, where if he was inside of a hospital and let's say it was some type of surgery, some I think it's more of a major surgery, uh, you would have to do the facility billing, and then you would have to do the physician billing. And depending on what it is, you have to use a TC modifier, which is the technical component, and then you would have to do the 26 modifier, which is the professional component. And that kind of gets a little confusing, just like it did me trying to explain it to you. So I hope I didn't confuse anybody about what they were doing and they thought to themselves, oh my God, I should be adding modifiers. No, it depends on the situation and the service and things like that. But it just is, that's what I love about medical billing, revenue cycle management. You're just constantly learning. There's things change all the time. The irritating part is that that means that you have to always be up on everything. You just have to understand the new changes all the time, and you have to make sure that you change your processes and your procedures on a regular basis to keep up with those changes, to keep up with that. Otherwise, you're going to have massive denials. You're going to have massive issues with bringing your money in. And and this is kind of like why I really love doing follow up for old AR, because it teaches you things that you would have never thought of in billing, uh, would happen in billing, or something where a patient would get denied for a certain service, or how an insurance can underwrite their own policy. And there's things that you know other insurances pay normally, but this policy says, oh no, we don't pay for that, kind of thing. So it's like you're constantly learning and you're constantly figuring things out. And I like to do research. I like to do research. It's like you give it to me and it's something wrong, I'm gonna find the issue. I just like to dig, and it's just something that's in me that I like to do. So that's one of the reasons why I'm in this field. And after so many years, I decided to just give it a try and see if I could do this on my own. And I really can say that I'm happy with what I do. And I believe that there's other people out there just like me who want to learn the ins and outs of medical billing, and move around and grow in the field and just learn, because you don't have to stay a medical biller in medical billing. You can grow into so many different areas in medical billing. At one point, I really crossed into kind of IT when it came to medical billing, and I was really thinking about crossing over completely before I got laid off. And then I just decided that it was my time to try and start my own business. But I was studying and going to school to get my certification in computer programming and something else, because I really wanted to move over to the IT side and work on systems more so than the billing aspects of revenue cycle management. So I hope that, kind of helped you to stop and think about what areas you want to go into as a medical biller, and or as a medical billing agency, which ones you would be interested in learning new billing on. And I just hope I gave you value in that. And if you have any questions, I will be answering them at the end or later on tonight, because I really need to lay down and take me a nap. And thank y'all so very, very much for showing up. And again, my name is Ruby Simmons. I'm your medical billing mentor, and I'm the owner of Blossom Revenue Cycle Solutions LLC. Catch me on IG at Blossom RCS LLC, on LinkedIn at Ruby C Simmons. I'm also on TikTok, TikTok, Blossom RCS LLC, and that's about it. So I really hope you guys enjoyed this, and I'll see you tomorrow in the study group. Thank you very much and have a good day. Bye-bye.